Good afternoon, everybody, and welcome back to Mentor RCA audio interviews with successful ST3 candidates. My name's Nigel Giam. I'm the lead training program director of the St Mary's scheme and an AKT and RCA trainer for HEE London. It's a real joy to have Rajiv on this interview. Really good to see you, Rajiv, and congratulations both in the AKT and in the RCA. So hopefully the courses are doing something.
Yeah, absolutely.
Yeah. So no, not at all. So it was really good to have you both on the AKT course, and you scored, I believe, 89% whopping score, and more recently on the RCA, 184. So I suppose obviously this is all about the RCA, but I suppose both my courses kind of focus on strategy, and there are so many, I think, mixed messages out there with regards to the RCA. What challenges did you come across, and what strategy did you take in to get that really good score?
Sure. So hi everyone. Firstly, thanks Dr. Giam for having me on the audio podcast today. I'm Rajiv. I'm one of the ST3s. I'm based in the West Midlands, and I just recently took my RCA for the March sitting. I probably have to say the RCA is probably one of the worst tough exams I've ever done. And this is my final exam at the end of sort of 10 years of education and things. But yeah, I found it really tough. Sort of challenging, almost sort of exhausting in aspect, because it just took so long in preparation. And also just the whole process of it, I really did not enjoy. But I think with the right preparation, and obviously I went on Dr. Giam's course, I think it is doable. It's just making sure that you do have the right strategy. So I think the main challenges I found with the RCA is just, firstly, when you are faced with going through the RCA for the first time, there are so many mixed messages out there. There's a lot of information out there from very different sources. I know there's a well-known one with our portfolio and things. That is obvious. And there's loads of other courses from lots of different educators, but I found actually that when I went on Mentor RCA course, that was actually a key turning point for me. And all my submissions actually came within the final few weeks after I'd done the Mentor RCA course. So I didn't submit a single consult before I'd done this course. And I think that is probably reflected in the score that I got, because I think the main challenges for me were actually around firstly, case selection, a big thing for me. I think prior to this, no one had really given me the right information about how important case selection is for the RCA. I think people are sometimes a bit, I personally feel comfortable with a lot of cases, but I was finding that these are often sometimes more simple cases, which is natural, I think. But I think for the RCA, it was really about making sure that your cases are the right cases and the ones that are going to enable you to score those points. And I think the other thing I found was really I didn't really have, until I'd done the course, I didn't really have a proper plan about how I went about my consultation. So I was often asking questions out of context, which actually, when I listened back, sounded very almost silly, like it didn't really have a proper flow. And I was often giving actually really crucial information about the patient from their notes much later on in the case, which then didn't really fit a proper pattern, if you see where I'm coming from. So I think the two main cases where I didn't have a strategy, and I just didn't have a consultation structure which really worked for me. So hence why I just ignored all of it. I recorded a lot, and I just kind of ignored the cases.
Yeah, because I think we talked over email about wanting to pass, but actually wanting to pass well. And we've talked a lot about this second golden minute, where if we think about it logically, I mean, patients come to see GPs because they've got concerns. So actually it's in our interest to open up that concern sooner rather than later.
Absolutely.
And then specifically using, as you say, the information in the patient's notes, to know where we are, so that there's a really kind of good flow. So that's very encouraging that actually, you took in a strategy, actually you were able to use that as a game changer with the limited time that you have left and still score 184. Absolutely fantastic. I suppose just what would your kind of take-home messages be for those who are now looking to go into the RCA in autumn? And unfortunately, we do have, you know, a sort of significant number of STs who've just literally failed it by a few marks, and unfortunately will have to extend. And so we'll be feeling a little bit down in the dumps, you know, having to kind of climb up that massive RCA hill. What words of encouragement have you got for them?
I think firstly, even if you are doing it for the second time, I think it is completely doable. I think if you have the right strategy and you have, you know, and you strategize your submission and you think about your submission before you submit, then you absolutely, you know, definitely can pass. I think what I personally did was, I know Dr. Giam has a sheet, a sort of an RCA mantra. I printed that out and I studied that and made sure that actually all those points and all the tips that he gave, I was trying to utilize them in every case. So I think if you have the right preparation and if you have sort of leave yourself time and make sure that, you know, you're following that proper structure, then you absolutely can pass. And, you know, with the score that I got, actually, you know, that was only from recordings over a 3-week period, or actually, I think there actually was less. It was probably about a 2-week period. So that's I think I changed my strategy. Yeah, I changed my strategy actually following, you know, so using the course material. So I don't, even if you are time pressured, I think there is, if you just put your mind to it, it's still possible.
Yeah, absolutely. So working smart as opposed just to hard. It's so good to have you back after the course. It's lovely to see you. What's the plan following CCT? The world is your oyster now. What are you going to do?
Yeah, I'm actually not sure. So I was thinking maybe you know, I've been off. My practice has said, you know, maybe they'll have me back on as a salaried GP. But I think maybe, you know, I might explore different areas and just see really. But yeah, I'm just excited that I've got no more exams left, which is great.
Yeah. Good. Holiday, mate. Holiday. That's what you want.
Yeah, holiday. First thing I think is going to be a holiday.
Good. All right, Rajiv, lovely to see you. Thank you so much for your insight, and do keep in touch. Many thanks. So thank you so much to Rajiv, who smashed the RCA, smashed the AKT. So hopefully we're doing something right on the courses. But specifically, he talked about a strategy and a mantra. And the mantra that we use on the course is really staying close to the patient's ice, because actually, if you have a look at case selection in terms of clinical challenge and the complicating factors, you can see that the complicating factors are housed within the patient's ice. So very important that actually we open that up, we follow it through and we use it, and then actually use the patient's notes to know that and showcase where we are in terms of the patient's narrative. Of course, there's no point in actually following through on ice if you're not going to readdress it. So bringing that patient into the second half and then ultimately committing to risk what we feel is most likely going on, so we can propose a reactive management plan around that. So we have to get into that management section. So don't give up, guys. You know, this is really, really achievable. We've heard some really inspiring narratives from graduates who have unfortunately failed the exam, but then gone on to smash the RCA, those who've done it for the very first time, those who've actually done it within a short space of time, working smart rather than hard. There is always hope around this. Do feel free to drop me a line anytime if you need any advice. And again, please use the resources, mentoremedicateducation.com, all the AKT, RCA information about courses and free resources, all there for you. Enjoy the rest of your evening. I look forward to seeing you guys again soon. Many thanks.